McDonald. I am the manager for healthcare quality and wellness at the Authority. And I want to take this opportunity to welcome all of you to this afternoon beneficiary educational session. These are sessions that we run every month with you, our beneficiaries in mind, with the hope of making sure that you are aware of what we're doing at the Authority and what we're doing behind the scenes to ensure quality care to all Bahamians. So this afternoon, joining me on the platform is Mrs. Chandra Sawyer, who is our health wellness specialist at the Authority. Also Mrs. Tanisha Pinder, who is our benefits manager, and Dr. Tonette Hanna, who will be speaking to you later on in the afternoon. So later on, you'll get a full overview of who they are and the topics that they'll be sharing with you this afternoon. But again, on behalf of the Authority, the hardworking people at NHI, all the members of the board of directors, we are excited that you've taken this time out of your afternoon to join us. And we want to welcome you to this forum this afternoon. So I'll be talking to you a little bit about who we are, what is our focus at this point in time at the Authority, where we are and where we're going. And then I will share with you the details around our presenters. And then Mrs. Dr. Tonette Hanna will bring her presentation, as well as Mrs. Tanisha Pinder. So thank you all again, and please hold your questions or put them in the chat for us as we go through the presentation. If you do have questions, please make sure and put them in the chat, and Mrs. Sandra Sawyer at the end of the presentations will present your questions to the speakers for this afternoon. And then Chandra will also talk to you about the way forward at the Authority and some of the initiatives we have upcoming. All right, so with that in mind, we'll get started. Next slide, please, Chandra. So a little bit about who we are at the Authority and what our mission and our vision statement is. We're all about leading the way in terms of healthcare, making sure that every Bahamian have access to quality, affordable healthcare, because we know our beneficiaries deserve quality care. As a part of our mission, we want to be the leaders in terms of transforming healthcare in the country and making sure that Bahamians are the center of everything we do in healthcare, and making sure that we're building a nation, a healthy nation that have access to quality and affordable healthcare. How do we do that? We accomplish that by being passionate about bringing to you universal healthcare. We want to be progressive in terms of providing the technology that supports quality healthcare. We want to be able also to build partnerships and relationships with our stakeholders in country, making sure that through these partnerships, you will be afforded quality healthcare. We want to make sure also that we're maintaining the integrity and the quality of the program at the Authority, making sure that we're transparent, we're sincere about the quality of care that we're providing to you, our beneficiaries. And then there's also a level of accountability for us at the Authority, as well as accountability for our providers in terms of making sure that we're providing quality care to our stakeholders and to you, our beneficiaries. And then we also want to make sure that we're providing the care in a respectful and honorable manner, and so that we respect the questions and the expectations of our beneficiaries, and making sure that we're meeting those needs as we move forward. Next slide. Some of the things we're focusing on at the Authority from a wellness perspective. We want to dedicate the whole platform around making sure that our beneficiaries are engaged in terms of adopting healthy lifestyles. So we want to encourage you and educate you on some of the things related to the importance of why regular exercise is important, why we should make that a part of our daily routine. We also want to make sure that you're eating healthy and understanding that food is as medicine. We become what we eat. And then we also want to be able to as an organization, make sure we're looking at our population and our beneficiaries, and making sure we're looking at the services that you're providing using a holistic approach. And what do we mean by a holistic approach? We want to make sure that your mental health, your emotional health, your physical health, your spiritual and psychological health are all a part of what we're addressing. And we're just not dealing with just the physical aspect, but we're dealing with you from a holistic, utilizing a holistic approach to care. Next slide, please. Okay, where we are now. NHI, over the last 5 years, going on 6 years, the authority was founded in 2017, is definitely making a difference. And as we advance towards universal health care, we're making sure that we are focusing on enrolling the entire Bahamian population. Currently, we have 136,000 individuals enrolled in the program. So they're all Bahamian citizens or legal residents of the Bahamas. Our population, the demographics is very diverse in the fact that we actually offer services to 17 islands. That includes 6,700 Bahamians that are under the age of 5 years old. And then for more mature citizens, there's about 16,000 Bahamians who are over the age of 65. And how do we know that we're doing what we set out to do? How do we know that we're enforcing or meeting our mission and our vision? You, our stakeholders, you, our beneficiaries, tell us that. We have a very high beneficiary satisfaction rate. We usually do beneficiary satisfaction surveys every 2 years, and some of you would have gotten a call from our benefits department wanting to know, what do you think about the program? What can we do differently? And so it's from that survey we can tell that 96% of those enrolled in the program are satisfied with the level of care that they're receiving. And that's pretty good. So we're pretty excited about that. And so we'll continue to work hard towards ensuring that beneficiary expectations and needs are being met. We're also focusing on expanding our provider network. Currently, we have 140 physicians enrolled in the program. We have 75 primary care facilities, and we have about 16 labs that span across the archipelago. And then we're also very excited that we want to make sure that our beneficiaries can access the electronic health record. And so we want to be able to provide digitally enabled care. And so we've invested in a very robust electronic health record, which allows you to, as beneficiary, to access our patient portal, to book appointments, and actually look at your labs or communicate with your doctors through telehealth. And that makes access to care a little bit better. So those of you in the family islands who may not be able to come to Nassau if your doctor is in Nassau, you can actually book an appointment online and you can have a telehealth visit. So we're pretty excited about that. Next slide, please. So now I want to introduce you to our speakers for this afternoon. Dr. Hanna, who is a really exciting, engaged provider. She works for Fleming Street Clinic, and she's also in private practice. She's certified in the area of family medicine, and if you ever go to Fleming Street Clinic and you ever have a problem, Dr. Tonette Hanna is the person to see. She's an excellent colleague and friend and comes highly recommended in the industry. So we're excited to have her talk to you this afternoon about primary health care. So I'm going to now turn it over to Dr. Hanna. Dr. Hanna, take it away, and then we'll come back with Mrs. Pinder once Dr. Hanna's presentation is finished. Over to you, Dr. Hanna.
Thank you, Dr. McDonald, for that, that exceptional introduction. Good evening, Bahamas. My name, as she stated, is Dr. Tonette Hanna, and I am a University of the West Indies graduate specializing in family medicine. So I'm a family medicine specialist. And I'm actually excited to speak to you as a primary care provider and to just give you some information in terms of what the NHI authority provides in terms of services and screening for the populace. After all, it's actually National Primary Healthcare Week, so I'd like to thank you for this opportunity once again. So to start, let's actually define what is primary care. Primary care is actually the first contact that the patient would have into any healthcare setting. And primary healthcare, we actually treat common diseases and ailments, but that is actually not what our focus is. Our focus is actually prevention and wellness promotion. Let me say that again. Your primary care physician, the focus is actually prevention and wellness promotion. Another thing why I love being a family medicine specialist is that we actually get to forge relationships with the patient. So for many of us, we meet you in the antenatal stage, and we are able to watch you mature through childhood, adolescence, into the older years if we all live. So that allows us to kind of watch the patient grow and mature, as we say, from the womb to the tomb. So let's get started. Next slide, please, Ms. Sawyer. Thank you. So infant and child healthcare screening from the primary care perspective. If you've ever entered a physician's office or you brought your child to the pediatrician, what's the first thing that you notice that the nurse normally does? The nurse takes your child's head circumference, their length or their height, as well as their weight. These are very, very important growth parameters that actually kind of tell us, is this child growing well? We also assess through history taking the child's developmental milestones, and this includes the physical, the cognitive, emotional, social, sensory, and motor, just to name a few, development of the child. We also assess the immunization status of your child. Now, in the Bahamas, immunizations actually start at the age of 2 months, and they continue along your lifespan, and I will get into those a bit later. So immunizations for common diseases such as diphtheria, pertussis, tetanus, measles, mumps, rubella, just to name a few. Also, we get a nutritional assessment of your child. So your primary care provider may ask, just tell me, what does little Johnny have in a day's period, in 24 hours, for example, breakfast, lunch, and dinner. And this kind of gives a synopsis or an overview about the child in terms of the nutrition, if they're eating foods from all of the food groups, and if there are any possible areas of concern that we might want to address. Also, there's screening for abuse or neglect. For males, we also check for testicular descent. It's very important. As well as when we order our lab investigations, we screen for anemia, which is very, very important, especially iron deficiency anemia in children, as well as sickle cell anemia in Black children. We educate you when you come in. For example, you have an infant. We want to make sure that the child is sleeping on the back. So we call that the back to sleep. They actually had a campaign called Back to Sleep a few years ago. We ensure that you're using the appropriate car seats and ensure that they're fitted well, helmets, smoke detectors, socket covers, etc. We also educate the older children, and as long as a child is able to understand, I actually institute this as early as possible. We call it the good touch and bad touch, so that the child is aware of his or her body and to know to speak up to someone they trust if they feel that they're being threatened in terms of for child molestation. We also encourage the parents to get dental visits for the child even as early as 6 months, because oftentimes this is an issue where parents allow the child to go to sleep with bottles in the mouth, so they may get dental caries, etc., very, very early in life. Next slide, Ms. Sawyer. So let's talk about our adolescent healthcare screening. And these are some of the areas that the primary healthcare provider focus on. Once again, your growth parameters. It's very important at this stage, we start to pay attention to things such as the child's blood pressure. I've seen children in my practice as early sometimes as 13 years old that are what we call pre-hypertensive, as well as the pulse. We calculate the BMI, which is the body mass index, to screen whether the child is of a normal weight, whether the child is overweight or obese. Other things such as in my history taking, I focus on the child's home environment. I ask about the home, about the setting, if the child is comfortable. Also education, are you going to school? What was your last GPA? Are you eating in school? If the child is older, I ask about employment and what are your career goals? Where do you see yourself in 1 year, 2 years, 5 years? Eating and nutrition. Once again, we ask the child, you ask the parents, can you just give me a synopsis or just a 24-hour look into what Johnny ate for yesterday? This also, once again, highlights if there may be any probable nutritional deficiencies, especially if the child is not eating foods from all of the food groups. Or if they're eating too many calories, or how should I say, not the correct serving and the correct portion of foods. We also ask about exercise and body image, pair relationships, and this includes interpersonal relationships as well. Tell me about your risk-taking behaviors. So these are questions that I would pose to the child and the child's parents. Do you do any drugs? Do you smoke marijuana? Do you use lean? And for the parents that don't know, we have cough medicine abuse because of the properties in it. Molly, do you use anything, or are there any habits that you've undertaken? Another important part of the adolescent screening, which even some physicians may not feel comfortable about, is actually the child's sexuality. The children now are more exposed, so you have to approach them and ask about gender identity, sexual orientation, and you actually be surprised at the answers. I'm fluid in the Bahamas, okay? The practices, are you having sex? And if so, are you using a male or female condom? These are actual scenarios and questions that are brought up in my practice daily. If you find that the child is already sexually exposed, definitely then this tells the physician that you need to do sexually transmitted disease screening. And these would include things such as HIV, syphilis, chlamydia, gonorrhea, hepatitis B, HPV, herpes, etc. I also screen the adolescents for homicide or suicide ideations. Yes, especially this group. Depression screening, risk-taking behaviors. Are you using seatbelts? Do you carry a weapon to school? And if so, why? How do you feel? Why do you feel the need to protect yourself at school? Do you feel safe? You address violence and conflict resolution. So as a primary care physician, within the last 2 weeks, I had the pleasure of having maybe about 5 males who were between BTVI and COB. And these were topics that I was happy to talk about with them. The mothers seemed quite pleased and impressed. But these are things that the primary care physician must remember to bring up, as well as things such as immunization for the children, especially HPV, your tetanus or your DTaP, we call it. And also remind these parents that these children too need vision, dental, and hearing screening. Next slide, Ms. Sawyer. So let's talk about the adult female healthcare screening. Generally, you'll find, and I think this is in most parts of the world, women frequent the doctor's office more so than women and children, I guess. definitely more than men. So generally, a woman might have been diagnosed previously because she's been coming in with high blood pressure, and you know that is done with 2 or more readings of 140/90 and above. Her pulse for things such as do I need to do a thyroid function test to screen for thyroid disease? Is her pulse rapid because she's anemic? You guys call that low blood. Or is she anxious or has anxiety? Also, I would assess the female's BMI, and we would discuss this. There again, we would go into what is a typical day in your diet, or what does it look like? For females, in my history taking, I screen as well for intimate partner violence. And we must remember to do this as primary care physicians, and this can happen in the heterosexual as well as same-sex relationships. I screen for depression. I ask the female, are you doing your self-breast examination? And at this time, you then take the opportunity to write it for a mammogram. During the physical, the female is given a pap smear, and this starts at the age of 21 years old, people, 21 and not before. All right. And it ends at 65, providing that she's had no 3 previous negatives, that is. Also for the female, we assess for nicotine and alcohol use or abuse, immunization status, what is her MMR status, the varicella, flu vaccine, tetanus, COVID vaccines, because we have, 1 or 2 trickling in that's asking for it, pneumococcal vaccine as well, family planning ambitions. So where do you see yourself in a year or 2? Would you like any more children? These are questions that the primary care provider asks for, because this is all a part of screening and health prevention and promotion. So when it comes to ordering laboratory investigations, and I must stress, these are provided free of charge to under all participating labs. And this is all paid for by the NHI authority. I mentioned the pap smear, the CBC, which is important to screen for anemia. We're screening for diabetes, thyroid disease, definitely all of your sexually transmitted diseases, testing your liver, your kidney function, your cholesterol levels. All of these are included, as well as colon cancer screening. So there is no excuse. Oftentimes people say, oh, I can't afford a colonoscopy, but NHI does have the FIT test included free of charge, which is actually a colon cancer screening method. We also screen for dementia as well. And we, like I mentioned before, we would order mammograms for our females. So let's talk a little bit about maternity care. Very, very important. Some persons may not be aware, but NHI also provides maternity care. Now, it depends actually on the comfort of your provider, so I'll be honest there, but maternity care is actually provided. So the screening for this female includes blood pressure, her weight. We would assess the symphyseal fundal height, and for those who want to know, to just ensure that the belly size is matching the baby size. Fetal heart rate, and we ask, are you feeling movements? Routine blood screening is ordered as well, all free of charge under NHI. That would include your urinalysis, your blood group and rhesus status. Testing for anemia and sickle cell disease, as well as diabetes in pregnancy, very, very important. Sex disease screening, as you know, these can cause miscarriage or actually early birth, early delivery, as well as ultrasound scan. Those are not covered, but your primary care provider still has the obligation to order them. Also, your primary care provider should ensure that you are having your prenatal vitamins ordered, especially the folic acid, which is important for the prevention of neural tube defects. Now for this group, the maternity care, we're still on that. Education is vital. So we're talking about a proper diet, and it is a physician's job to ensure that the patient is following and adhering to a proper diet to ensure health and wellness for herself and the baby. You teach about breastfeeding, if the mother can breastfeed, infant care, and you also educate the mother on what she should expect during each trimester. I educate you on what you should expect during delivery, as well as in the postnatal period, especially postnatal screening for postpartum blues and depression, as well as deep vein thrombosis. Very, very vital. Next slide, Ms. Sawyer. Let's get to my males, my Bahamian males, or my males. Okay, so we know males don't normally come in unless there's something wrong, but I figured out what to do. I screen you, I give you an annual screening anyway. I don't care if you hit your toe. I am going to do the annual screening on you anyway. And this includes for your blood pressure again, your pulse, your BMI, as we mentioned before, for those who forgot, and that is screening in terms of to assess the patient's weight for whether they're normal weight, overweight, or obese, thyroid issues, etc. Now, for men, there again, I'm not sure of some of my colleagues' comfort level, but you have to screen them for erectile dysfunction issues because they suffer sometimes in silence and say nothing. So this is one, and that kind of lets the man know that, hey, you know, this doctor is willing to listen to me and she's actually concerned about me. I also screen my Bahamian men, or men that are in the program, I should say, because we don't only serve Bahamians, for intimate partner violence. Yes, men experience domestic violence too, okay? Also, if he's a smoker, lung cancer screening, depression screening, dementia screening. What about alcohol and nicotine use and abuse? You must also screen those areas. Another important thing, breast cancer screening. I have an NHI patient that I see in my private practice that his mom and all of his sisters had breast cancer. So he was taken aback at first. And I'm like, I gotta do a breast exam. And he's like, really? I'm like, yes, you need breast cancer screening too. So I taught him the breast exam, and he actually knows now in terms of looking for lumps, cysts, or swelling, checking his lymph nodes. So, you know, you have to make the man more comfortable and let him know that that part matters as well. Other things in terms of lab investigations, definitely the PSA, the prostate screening. Once again, the colon cancer screening, STD screening, cholesterol screening, all of those things which are, again, provided free of charge. For my males, I ensure that their immunization is brought up to date, especially for men who are injury prone. Yes, when was your last tetanus, sir? They're always getting some cuts or nicks. Influenza vaccine, meningococcal vaccines, COVID vaccines. Yes, I'm asking you, are these up to date? Other things, how are you coping? You want to talk about violence, prevention, safety, seatbelts. If you have a motorcycle, are you wearing your helmet? Also, gun safety for those that have legal firearms. These are things that I try never to forget and discuss with my patients, as well as reminding them that they must keep up with their dental, eye, and hearing screenings as well. Now, I must take the time to note that all of these screening modalities that I mentioned, remember, when you go to your primary care physician, everything is individualized based on the history they took and based on the needs wherever they see the need, they will then order the appropriate investigation. So it's not a one-size-fits-all scenario. So you cannot say, well, so-and-so had a chest x-ray for lung cancer screening, but I didn't get one. Well, you don't smoke, so I didn't see the need to do that for you. So that is just one example. Someone who may have, like I said, I did a breast exam on one male, but I didn't do it on the other males because it was based on the history that I took. So remember that, please, to keep your annual appointments with your physicians. It's there for you. utilize the service, and I hope that I was able to provide some help and a bit more knowledge on the program and how it works for you. Thank you for listening. I will now turn it over to Ms. Tanisha Pinder.
So thank you, Dr. Hanna. Appreciate your input regarding primary health care, and it's exciting to hear all the various tests and screening that you do at Fleming Street Clinic. That's pretty exciting. And so I would just want to put a plug in here for the program for those of you who are enrolled in NHI. Like Dr. Hanna said, the expectation is this is preventative care. We want to make sure you go in and see your doctor every year and not wait until you get sick to see your doctor. So thank you, Dr. Hanna. Hopefully our audience found this, I'm sure, to be extremely beneficial. And if you ever have additional concerns or questions, Dr. Hanna works at Fleming Street Clinic, and you're always welcome to go and visit her there. Right, Dr. Hanna? All right. So coming up, our next guest speaker is Mrs. Tanisha Pinder, who is our benefits and enrollment supervisor at the authority. And some of you may have met her if you were in any of her sessions during enrollment. She's a wealth of knowledge around how we do business at the authority, and in terms of how do we enroll patients, beneficiaries, how do we ensure that you get the quality care that you rightfully deserve. So I'm now turn it over to you, Mrs. Pinder.
Good evening, everyone, and thank you so much, Dr. McDonald, and thank you, Dr. Hanna, for enlightening us on primary care services. Very comprehensive and detailed information. Thank you.
My pleasure.
Sure. Yes. So this evening, I'm just going to share with you the current benefits that are being offered by the NHI Bahamas plan. So yes, so primary care services. So the NHI plan covers primary care services as well as your lab services. And so under the NHI Bahamas plan, beneficiaries currently have access to their general physician visits. That's unlimited visits with your primary care provider, your annual physical, maternity care, pediatric care, periodic health assessments for those persons with chronic illnesses, laboratory testing, vaccinations, immunizations, cancer screenings. Currently, we offer the PSA test for men over 40 and the pap smear. We also offer the full panel of STD screenings as well, and chronic disease management. Next slide. So let's look at the expecting mother. So under the maternity benefits package, the expecting mother is entitled to her pregnancy test, 7 to 9 prenatal doctor visits, her lab tests, as well as screening for genetic characteristics. Earlier, Dr. Hanna would have broken down exactly what the mother can expect once she has that visit with her primary care provider. For our infants, once they receive their NIB Smart Card and enrolled into the program, they're also entitled to their lab tests, growth measurements, all immunizations, their regular checkup, and unlimited sick visits with their pediatrician. Next slide. For our school-age children, all school-age children are entitled to their annual school physical, their growth measurements, developmental screenings, asthma care, and all immunizations, as well as unlimited visits with their primary care provider. For the adults, you're entitled to your annual physical, unlimited general sick visits with your primary care provider, NCD screenings, such as early detection and disease management, assessment of healthy lifestyle choices, which includes diet and exercise, safe sex, and the risk of alcohol and tobacco use. Vaccinations, the annual prostate test for men over the age of 40, as well as we have the pap smears, full panel of STD screenings, and also counseling on how to reduce the risk of these diseases. So this is currently what our beneficiaries are entitled to and can access under the NHI Bahamas plan. What we do not cover at this time is overseas care, dental and vision, prescription medication, emergency care such as heart attacks or broken bones, inpatient hospital care, surgeries, chemotherapy, and radiation. We do not cover rehabilitative care or deliveries of babies. Currently, we do not offer any diagnostic imaging, such as the mammograms, ultrasounds, ECGs, x-rays, colonoscopies, MRIs, and CT scans. What we are hoping to, however, we are hoping to add diagnostic imaging in 2023. That's something that we are looking at. And hopefully we are able to add diagnostic imaging, and we will be able to offer the mammograms, ultrasounds, the ECGs, x-rays, and colonoscopies. Thank you, Ms. Sawyer. I'd also like for you to note that the NHI program is being rolled out in a phased approach, and we're continually looking to add additional benefits as we continue to grow this program. So who can enroll into the NHI program? To register for NHI, you must be a legal resident of the Bahamas and have an NIB Smart Card. This is all that is required. There's no age restrictions to who can enroll. Once enrolled, you will select from one of our providers from our network of primary care physicians. You will be covered for unlimited number of primary care visits at no cost at the point of care. There is no registration fee, no deductibles, no copays. And you can change your primary care provider for any reason at any time. Next slide. So presently, we offer 4 easy ways for persons to enroll into the program. Online, you can visit us online at nhibahamas.gov.bs. Once stroll down on the page, click on Enroll Now and just follow the steps, or shoot us an email on info@nhibahamas.gov.bs. Please provide the pertinent information such as your full name, your NIB number, and contact information. One of our customer service rep will reach out to you within 24 hours. Or feel free to give us a call on 396-8500, where one of our customer service rep will be happy to assist you over the telephone. Or we'd love for you to come and visit us at our office on East Street and Purpose Way. We're open from Monday to Friday, 9 until 5 p.m. Next slide. So here are some tips that we offer, especially to our new beneficiaries. As Dr. Hanna said earlier, preventative care is the key, and this is also the main focus of the NHI Bahamas program. Your primary care provider mission is to help you stay healthy. They are there for you, whether it's for an occasional illness or support and guidance in managing a chronic condition. So here are some tips. Find out if your doctor accepts walk-ins or appointments by calling ahead before visiting. Share any symptoms that you may have via the telephone. This will determine whether your doctor has a face-to-face visit with you or will have to have a telehealth visit. Make a list of your concerns. So any symptoms that you've been experiencing, we ask that you write those down and present them to your provider, because in most cases, when we're in the front of our doctors, we don't remember all of the things that we've been experiencing. So we always ask our beneficiaries, write those things down, share that information with your primary care provider during your visit. Be open about your medical history, inclusive of any prescription or non-prescription medications you are taking. This will determine your cost of treatment. Also, very important, mention any allergies that you may have. We also say, ask about any medication prescribed. Ask your doctor, why is it being prescribed? What are the possible side effects and how should it be taken? We love to encourage our beneficiaries to build relationships with their primary care provider. You should never feel uncomfortable having any conversation or explaining how you're feeling with your primary care provider. You should never leave that office not sure as to what is going on with you, with your health. Please go ahead, ask your provider, build that relationship. I'd also like to take this time to encourage our beneficiaries or all persons to have those annual physicals done. NHI covers your annual physical, so please, we as Bahamians always feel as if, we're not sick, we don't feel sick, so I don't need to go to the doctor. But that is not the case. Every single person should always make sure that they're having that annual physical done. You never know what is going on inside of your bodies, whether you feel sick or not. So we want to encourage persons to please utilize the system and have those annual physicals done. Next slide. So at this time, we will open the floor for any questions that you may have. Ms. Sawyer.
Good evening, Bahamas, and good evening, Ms. Pinder. In the chat, we had quite a few questions, and I think a lot of those questions were premature because they were eventually covered in the presentation. However, I do want to reference a question that speaks to arthritic conditions. I am a 67-year-old person, and I've been plagued with arthritis in my knees. Is this benefit covered under the NHI Bahamas program? Can you speak to that, Ms. Pinder?
So yes, so that would be covered as a sick visit under the NHI program. Now, if the doctor needs to order anything additional as far as X-rays, then that would be an out-of-pocket cost to the beneficiary. But the visit itself, yes, will be covered by the NHI plan.
Also, I'd like to add, Ms. Sawyer, that, let me come a bit closer, sorry. All right, so if the sick visit would be covered for that patient, the X-ray at this time, no, they would have to pay for the X-ray privately, as well if there's any treatment that is associated with that. For example, of course, if you order medication, oftentimes patients say, well, I don't have the money to get it. So we tell them that is not under NHI at this time, as well as if there is any in-office treatment, the patient will have to incur the cost on themselves, okay? So that's not covered.
Thank you, ladies, thank you. So I just want us to go back to the conversation that we would have had about annual physicals. And I know that's a healthcare service that falls under primary care. Dr. Hanna, in your presentation, you said a line that really stood out to me in your opening remarks. You said primary care services focuses on prevention and wellness promotion. This question has to do with our annual physicals for adults. Our annual physicals under the NHI program is free, right? This question pertains to what all would be covered under the annual physical as it relates to the NHI Bahamas program. I think the individual that's asking the question would like to know so that they could know what services they may have to pay for out of pocket, which may not be covered, that's associated with an annual physical. So can you clarify that for me?
Okay, definitely. So as I said before, with the annual physical, once the doctor has taken a history and we have done, your vital signs and giving you a physical exam, we will then know what exactly it is that we need to focus on, because not all screening is done for everyone. However, for the annual physical, the female will have her breast exam. She will have a pap smear. The pap smear is covered. She will have, like I said, hypertension screening. She can have the urinalysis. She will have the STD panel or screening, thyroid screening. If she is over the age of 50, she will have the FIT test, which is the stool screening for colon cancer. She will also have, did I mention thyroid? Thyroid. Right, right. The CBC screening, all of those are included for free. However, at this time, the mammogram and the ECGs will have to be paid for out of pocket. Those are not covered. However, Ms. Pinder did mention that in future, there is plans to bring them on, hopefully by 2023. I hope that answers the person's question.
So the person that also asked that
Sorry,
question
one more thing.
made
Sorry,
a statement. Okay, go right ahead.
Yeah, as well as pregnancy tests, because that is also an issue of an area that many persons are concerned about. That is covered for free as well.
Okay, so Dr. Hanna, as it relates to, go ahead, Ms.
Chandra, that
Pinder.
would be the urine pregnancy test. That has to be done at the labs. Okay.
Okay.
So any urine test, it must be done at one of our laboratories. If it's done in the provider's office, that is an out-of-pocket cost to a beneficiary. The urine
Okay, so
test,
yes, I was just going to mention that because they mentioned that they had to pay for a urine test that was associated with the annual physical. So thanks for that clarification, Ms. Pinder and Dr. Hanna. Ms. Pinder, can you speak to reassignments under the NHI Bahamas program? We have a question concerning changing my kid's pediatrician. How would an individual or beneficiary go about changing their pediatrician or their primary care physician?
So the process is very simple, and all NHI beneficiaries, you are permitted to change your provider at any time for any reason. You can simply shoot us an email on info@nhibahamas.gov.bs and just provide your NIB number as well as the new preferred physician, or you can simply just give us a call. We can facilitate the reassignment over the phones as well. 396-8500. The process is very, very quick and easy.
Thank you again, Ms. Pinder. I think from just checking the chat, it seemed as though we would have covered all of the questions that would have been placed in the chat. So I would like to, I would give the participants on the call just a few more seconds. If you still have a question, you have an opportunity to place your questions or concerns in the chat. And so Dr. Hanna, there is a question that's also coming up in the chat, Ms. Pinder. Which labs are considered an NHI lab?
So we have partnered with 9 major labs here. And your doctor office will determine the lab that they will use. But we've partnered with the Bonaventure Lab, Doctors Hospital, Premier Lab, and Bahamas Medical Labs here in New Providence. And then we also have labs in Grand Bahama as well as in Eleuthera.
Thank you. I think you were trying to also say something, Ms. Pinder, prior to that question about the NHI labs.
I was just making sure that the beneficiaries understand that lab works can only be ordered through their primary care physicians in order to access NHI. You cannot just show up to a lab without a provider from the NHI network ordering those labs for you, and your labs will be ordered through the EHR system and sent directly to the lab of choice, okay?
And it has to be your provider.
And it has to be your primary care provider.
Yeah, so that is definitely important to remember. Being a part of the NHI Bahamas program, we partner with providers that fall within our network, and anything out of the network would not be considered or would not be covered under the NHI Bahamas program. So it's also very important for us when we assign ourselves to our providers. You can always pick up the phone, send us an email just to verify that you are aware of which provider that you are attached to. You can go and visit their offices so that you do not incur any out-of-pocket charges.
So Chandra, I see a question here. Dr. Hanna will respond to.
Yes, the question about the pap smear.
Yes.
Yes.
So it says, what is the minor and maximum age for a pap smear? So pap smears, according to the American Academy of Family Physicians, according to the American Cancer Society, according to the American College of Obstetrics and Gynecology, et cetera, et cetera. And these are all, these are all scientific bodies, people. Pap smears start at the age of 21 years old, not before. A pap smear should be done every 3 years if it's negative until the female is 29. At the age of 30 years old, the female can have what we call co-testing done, which is the HPV testing and the pap smear, and that can be done every 5 years, or she can opt to just have the HPV testing alone every 5 years. Pap smears stop at 65 years old as long as you've had 3 previously negative pap smears, or for a woman that might have had what we call a hysterectomy, but I like to see the pathology because I like to ensure that she's had the cervix removed, because that is what the area we're looking for, which is called the transformation zone. So if she doesn't have a cervix, then she can opt to not have any further pap smears. So it's very important to also find out, because a woman says, oh, well, I had a hysterectomy, I don't need a pap smear. But if you had a hysterectomy and you still have a part of your cervix in, ma'am, you still can get cervical cancer. So you may still need to continue that. Okay, so I hope that answers the person's questions, okay?
Yeah, thank you for that very, very thorough.
Yeah, so Dr. Hanna, while we're talking about pap smears, right, for females, can you just discuss a little bit about the PSA test, right, for men, what they should expect when with the PSA test?
Well, the thing is, the prostate screening in terms of the digital rectal exam is very, how should I say, it depends, because this is something that the doctor should discuss with the patient if they would like to have that screening. All right. There are some school of thoughts that think you should start at 40, some at 45. Okay. You also get the history of the male. Have you had a previous relative with prostate cancer? Because sometimes, and I should have also said that, and not cervical cancer, but like breast cancer, you might have to bump it up. Okay, because it depends on your genetics and your predisposition. Okay, so 40, 45. If the man does not want a digital rectal exam, it's fine. He can still get the PSA screening, because some schools of thought actually think that it's really not necessary at this time, that they go through the digital rectal exam, but it depends. Now, if you have a traditional physician, they're still, and I'm going to be honest, okay, I did 2 DREs for the week, so I'm still doing DREs today. Okay.
Well, they have the option, they can just go with the blood.
Yeah, they can definitely do the PSA. It's only a blood test. It doesn't hurt, you know, that's the least you could do. So what we're looking for actually is the rate of rise. Okay. And sometimes, you know, just a small rise may mean that you might have had some sex before, or just a mild prostatitis or something going on, but not that it's necessarily cancer. So you just repeat it, and then you do the interpretation based on what you see, and especially the interval and the rate of rise, we call it.
Oh, during a pregnancy. Okay. All right. And
Dr. Hanna, I'm sorry, go ahead.
Yeah. So someone was asking where they can find our providers listing. It's on our website under helpful documents.
Thank you, Ms.
Okay.
Pinder.
Dr. Hanna, sorry, Chandra. Dr. Hanna, you talked about a little bit about pap smear. Can you address the timelines for mammograms as well, please?
Okay, for mammograms. So we are in the Bahamas, you know, we have many of us carry the BRCA1 and 2 genes. So generally for mammograms, the rest of the world, it's about age 40 that they start. However, in your screening and your questions, once again, from the history, if a female states that my mother had cancer, breast cancer diagnosed at 35, I cannot start at 40, she may be dead. Hence, I may have to bump that up by about 5 years. So screening, if there is no previous first-degree relative with breast cancer, you can say you start at 40 and you have your annual screenings. And I'd like to put in a plug. I don't own any imaging centers. However, this is Breast Cancer Month. So there should be no reason why persons are coming and saying that they cannot afford a mammogram at this time. Many places, including some of the number houses, as long as you have an account, some persons offer severe discounts. I call it severe because if you can get a mammogram for $50, that's a severe discount. I know doctors had a special. I think Fort Terrace had a special, and I have no horse in the race, people. I'm just giving you information. I don't know what Oak Tree is going to do. Oak Tree, do something for the people. Okay. So there are places that are offering it. So please, everyone, take advantage. Get your annual breast screening. Okay. And this is done until the age of 75.
Thank you, Dr. Hanna. Dr. Hanna, I know we mentioned a few moments ago about the pap smears and the testing and guidelines, but someone is asking a question. What is the guidelines for pap smears during pregnancy? Would those guidelines still apply?
Well, there are several, this is the thing. For me, generally, if a woman is beyond the first trimester, I don't normally give a pap smear because I try to just leave that undisturbed until after. Okay. If you don't normally have to go in there, I don't go in there until after. But it also depends on, you ask again, when was your last pap smear? She might have just had one done the year before, so that can wait. All right, so it all depends. So some physicians generally kind of use their discretion on that, but generally not beyond the first trimester. Not advisable.
Okay, thank you. We have a question as it relates to a provider and a facility. What happens if you visit a clinic to have an examination completed and they do not have the necessary equipment and they refer you to another provider? Does NHI reimburse that procedure?
Excuse me. Yeah, that's confusing. You answer that. Equipment.
So Chandra, I would definitely need more details from this beneficiary. I think it's Michael Green. So if you can just have him reach out to me so that I can get some additional information from him to find out exactly this. I'm not understanding the question and what the equipment is that was needed.
Yes, definitely.
Yeah, because it sounds like it could be something that is outside the scope of primary care and sound like a procedure which we do not cover. But I'd like to have an offline conversation with Mr. Green. So Mr. Green, if you're listening, please feel free to contact me tomorrow at my office. My number is 396-8525 so that we can discuss it further. But NHI does not reimburse persons, but we can assist as far as we'll resolve the issue for you, but we're not in the habit of reimbursing persons.
Thank you, Ms. Pinder. Dr. Hanna, I just think it's also very timely since we are in Breast Cancer Awareness Month, and Breast Cancer Awareness Month also leads to talking about a lot of women's health related issues. But the individual is asking that it wasn't mentioned if a pap smear is required for women who aren't sexually active. I know we stated the age 21 as the recommended age for the initial start of having pap smear testing. If at 21 that individual is not sexually active, is a pap smear still advised?
Yes, ma'am.
Okay. I think that is I think screening primarily is very important, and speaking about primary care, I just always want to go back to what you mentioned earlier. Prevention is better than cure, Dr. Hanna, and focusing on wellness promotion. And so if there's an opportunity to partake in any type of screening, especially if it's to be conducted at the required age and you're at that required age, I think it's always important. It's always good for us to know our status, to know our numbers, so that we can help to reduce the onset of any illnesses and help to treat those illnesses before they get to a stage where They're too far and too long gone. And so,
And that's why the NHI Bahamas program was created, right, for preventative care, and also to ensure that every Bahamian, every Bahamian citizen and residents have access to primary care services. So we want person to take advantage of this, right, and ensure that they are having these annual physicals done. Like you say, preventative care is our main focus, and prevention is certainly better than cure.
Yes, all that is true.
and so I think this actually brings us to the end of our questions this evening, ladies. Thank you so much for the wealth of knowledge that you would have shared with all of us that are here on the call. I know we are also going to share the recording via our social media pages, particularly on our Facebook page and on our YouTube channels. So feel free to log on to those social media sites, type in NHI Bahamas, and you will be able to access our pages once you like our pages. And we're also going to encourage you to share our pages with the public, share our pages with your friends, with your family, with your colleagues, and also tell them about the NHI Bahamas program and how they can enroll and receive the benefits that are afforded to them as Bahamians and legal residents. So before we end the call, we just want to talk about 3 wellness initiatives that we are currently promoting at the National Health Insurance Authority. Every 3rd Thursday of each month, we've been hosting the Power Hour, which is a complimentary 1-hour workout, which is led by a certified fitness instructor. And this is an opportunity for you to not only work out by yourself, but we encourage you to bring your family along with you, bring your kids. We have a lot of individuals that attend our workouts that bring their children. So you don't have to find a babysitter, bring them along with you, and they do not have to be an NHI beneficiary. We also provide an opportunity at the Power Hour for you to sign on to the NHI Bahamas program. On a monthly basis, we host our beneficiary educational sessions, either in a virtual platform or face-to-face. And these sessions are intended to educate the Bahamian public on special health and wellness observances for the month, in addition to educate you on different aspects of the NHI Bahamas program, such as tonight. And then thirdly, if you are a beneficiary, you would have been receiving our wellness newsletter, which is released every quarter. And this is an opportunity for you to receive updates on the NHI Bahamas program, tips on fitness, healthy recipes, and more. These newsletters are also shared on our social media pages. And so they are also available to the public. And so we want to take time to thank you for joining us this evening. I'm just going to share our contact information pages. Again, if you need further information, if you are interested in enrolling into the NHI Bahamas, if you would like to reassign your provider, please feel free to send us an email at info@nhibahamas.gov.bs. You can call us in the morning, 396-8500. You can also register or enroll via visiting our website, www.nhibahamas.gov.bs. And feel free to like, follow, and share us on our social media platforms. We have Facebook, Instagram, LinkedIn, and Twitter. So you have various opportunities to stay connected with us at the National Health Insurance Authority. Again, we thank you for your time. We thank you for the engagement. We thank you for your questions. And we look forward to you joining us again in the future. Have a great evening, everyone.
Thank you for listening, Bahamas.
Thank you.
Dr. Hanna, or
Yes,
Mrs. Pinder, Chandra, I'm sorry, we overlooked a question. Someone was asking a question about thyroid medicine. Linda Smith. I think we overlooked that one. Can we answer that really quickly?
I sent them a message directly, but
okay.
we can speak to medications.
So medications is not covered under the NHI Bahamas plan. We do not cover prescription medications at this time. And I'm not sure what the medication is for thyroid, but she may qualify for the national drug plan. Okay.
There is one thing that I know we've ended, but this is something that I need the Bahamian public and all of our residents to know. When you go to your primary care provider under the NHI, I tell them there is no reciprocity, meaning if I write your chronic non-communicable disease medication, such as your blood pressure medication, your sugar medication, your thyroid medication, your seizure medication, your STDs, any type of medication, that is not covered under the plan. And if I write it, it has to be written on my private script, which means you will then have to incur the cost for that separately. Now, many persons have been asking, because they know I work publicly, can you write that on a government script? So this is something that I brought up to NHI and asked them, sorry, not to speak out of turn, but I've asked them to look at this because it is something that many of the populace are going through, having to come to see me only to not be able to write up medication because it's on a private script and they don't want to incur a certain cost. So then sometimes they then have to come and see me at the public clinic to do all that all over again. So these are kinks that the NHI been made aware of, and hopefully the powers that be are looking into it, because it's almost like double working actually. But for what parts of the program are working, especially the screening, please utilize the program. Utilize the program, get your annuals. It is covered free of charge. Thank you again.
All right, thanks everyone. Have a wonderful afternoon. We appreciate you taking the time out of your afternoon to be with us, and just want to say thank you to Mrs. Pinder and Dr. Hanna for a wonderful presentation. Thank you, Chandra, for engaging our audience and making sure the questions were answered. Look forward to the next session, and so please be sure to share with everybody the importance of attending these sessions. Thank you so much, and we'll have a wonderful afternoon, everybody. God bless.
Good evening, everyone, and thank you.